Hello, my name is Dr. Chet Roten, and I am presenting our quality improvement project titled Cut the CAUTI, Reduction of Indwelling Catheter Days. This project was completed through Omeco Internal Medicine and Tahlequah. The goal of this project was to reduce unnecessary Foley catheter days at Northeastern Health System and in turn decrease catheter-associated urinary tract infections, or CAUTIs. CAUTIs are one of the most common hospital-acquired infections and are often preventable. Prolonged Foley catheter use increases the risk of bacteriuria, catheter colonization, infection, urethral irritation, reduced mobility, and prolonged hospitalization. Our primary aim was to reduce indwelling Foley catheter days by at least 20% compared to baseline in each department. Our secondary goal was to decrease the number of CAUTIs in the hospital. For our methods, we worked with the infection control officer who was already tracking Foley catheter days and CAUTI events. We reviewed data from our four departments, the CVICU, the MICU, CCU, and MedSurg. Baseline Foley day data were collected from January through August 2025. The baseline averages were 97 days in the CVICU, 54 days in the medical ICU, 46 days in CCU, and 86 days in MedSurg. Our intervention began in September 2025 and focused on education, daily Foley review, and reminders for timely catheter removal. We created and posted a Foley reminder flyer in the nurses' stations and resident room. This flyer, shown in Figure 6, was the actual intervention material used during the project. It prompted staff to ask, does this patient still need a Foley today? If there was no valid indication, the Foley should be removed. Figures 1 through 4 show monthly Foley days for each unit after the intervention. Each graph includes the unit's Foley day trend, baseline average, and 20% reduction goal. Overall, Foley days remained variable, and the project did not achieve the primary goal of sustained reduction for 5 consecutive months. CVICU did not meet the reduction goal during the intervention period. The MICU and CCU showed improvement in January, but this was not sustained. And MedSurg reached the goal in October, but Foley days increased again afterwards. Figure 5 shows monthly CAUTI events by unit before and after the intervention. Prior to the intervention, there were 8 CAUTIs from January through August 2025. After the intervention began, only 2 CAUTIs were identified, one in MedSurg in December 2025 and one in CVICU in March 2026. Although we did not achieve sustained Foley day reduction, the decrease in CAUTI events suggests that daily Foley review, education, and reminders may still have improved catheter safety outcomes. There were several limitations. Many ICU patients require Foley catheters for accurate intake and output monitoring, critical illness, immobility, or prolonged mechanical ventilation. Another limitation is that we measure total Foley days by department rather than Foley days per 1,000 patient days. If census was higher, total Foley days could increase even if Foley utilization practices improved. Future recommendations include adding mandatory line and catheter checks at the end of rounds, working more closely with charge nurses to ensure daily Foley necessity review, and recognizing units that successfully reduce Foley days. In conclusion, this project did not meet its primary Foley day reduction goal, but it identified important workflow barriers and was associated with fewer CAUTI events after implementation. Continued education, daily reassessment, and strong nursing provider communication will be needed to produce sustained improvement. Thank you.